Welcome. This is Charles Epstein for the Catalyst Podcast. Today, I am joined by Jim Wallis, Director of Business Development with Chestnut Health Systems. Jim has over 32 years in behavioral health, starting his career I was about to say 1889, Jim, but I don't want to date you that badly or inaccurately. Starting his career in 1989 as a Deputy Juvenile Officer working with at-risk adolescents in Missouri's Pike, Lincoln, and St. Charles counties. He went on to become Service Coordinator and Facility Manager with the Missouri Division of Youth Services as an adjunct faculty member of the University of Missouri St. Louis. Jim also teaches a master's level family policy and advocacy class at the School of Social Work. Jim, hey, thanks for joining me.
Thanks for having me, Charles.
Yeah, no, you are a busy human being, so I appreciate you taking the time. I need to ask you straight away. I was on your LinkedIn page. You got a BS in criminology and criminal justice, University of Missouri. What drew you to that?
Yeah, it's a great question. I graduated high school and I know I wanted to go to college, but I didn't know where I fit. And so tried to go down some paths that were more math and science based, and that's not my strong suit, computer science, economics, and but I've always been a kind of that firstborn helping person. And my dad was a sheriff's deputy in St. Charles County at the time I was turning 21, and there was a new juvenile detention center opening up in that county. And I went and applied, and then I really changed my major to work in criminology and criminal justice psychology, and it was the rest is history. It just everything clicked, and University of Missouri St. Louis kind of helped me find my path, and went on to get a master's in counseling, and was a real interest factor. I kind of funny story. I want to be in the helping profession, so I go into juvenile detention, which it's the kids that are deep and institutionalized as you can be. And I found over the course of the next 15 years, I could do more helping by getting more on the treatment side of the continuum.
Mm.
And that's exactly what I did, and ended up in not-for-profits and working for Chestnut. But it took me about 15 years to get from the criminal justice side to the treatment side.
Interesting, which anticipates the next question. Your work with Chestnut. You've been with them what, a little under 10 years, correct?
10 years in October.
10 years in October. All right. Well, we may have to have you back for a virtual balloon drop.
Yeah.
But in any case, if you would, for our audience, describe your work and particularly how you've grown Chestnut's footprint in Missouri or across Missouri.
Yeah, I mean, business development, and I started out with a master's in counseling and really ran clinical programs for years, but I've always had a passion in community relations, business development, and it really is all about relationships, figuring out ways to partner and collaborate. And it could be organizations that provide like services. How do we not duplicate each other? How do we complement each other? It could be funders. How do we best utilize the dollars that you're giving us and make that an investment that's a win on your end? And I did that for many years in Missouri, and coming to Illinois, really one of the goals was to uh, bring the Chestnut footprint where it made sense into Missouri. And I thought in 2016 that was going to be a sprint and we'd do it at the snap of a finger. It really turned into a marathon. And about 3 years later, we had our first opening opportunity to provide services, bricks and mortar, staff on the ground in Missouri, and really over the last 5 now plus years, um, the rest is history. We've really grown exponentially.
Yeah. So the initial resistance was it really primarily a function of not having that experience, not having things to point to show the success of what you're doing.
Yeah, I think it is a little bit, and again, 30 years working in Missouri, I never thought twice about Illinois. And then going over to Illinois, One of the things that jumped out to me, and I told my probably a couple weeks in, my supervisor at the time, Dave Sherrar, the CEO of Chestnut, man, there's a Chestnut wow factor. You're doing so much, and people don't realize that, and how to tell that story on the Missouri side. The resistance, in what I believe is the resistance, is a lot of times state to state, they can be separate planets. And we have an opportunity in the St. Louis metro region. Is Illinois and Missouri are connected by a lot of bridges, and the St. Louis metro area expands in Missouri and
Mm.
Illinois. The people most in need, the people that need services and can benefit from our services, they know how to use the bridges. They know how to get connected to services on both sides of the river. The resistance and the barrier is a lot of times the professionals, the insurance companies, Medicaid, funders, they don't operate in a bi-state collaborative way. And so creating those kind of mechanisms have really allowed us to do more and build relationships on both sides of the river.
Yeah, speaking of that, in the lead up to this, talking about several of Chestnut's quote unquote signature programs, and as you know, we discussed on this podcast the Metrolink program. I want to actually talk about some of the other signature programs, but for people who are not familiar with that Metrolink program, maybe you can give an overview of it from your perspective on the Missouri side.
It's an exciting program. It's small. It's in its infancy, 3, 4 years old, with great outcomes. It's a private partnership with bi-state development that works both in Missouri and Illinois, thus the name bi-state. And it was a great collaborative partnership where in St. Clair County, Illinois, the transit district over there saw a issue of riders that would ride the system all day long that had substance use issues, mental health issues. At the time, the only response the transit district had was a police, law enforcement, or security response. Well, these individuals didn't need a police, law enforcement, security response. They needed somebody that could help them and get them connected to services. So we established a program over in St. Clair County, Illinois in 2021, and it had good results pretty immediately. And about 16 months later, over in Missouri, after going through a lot of different funding mechanisms and a lot of different conversations, we established the program in Missouri. And the Metro Transit System, for those that don't know, run from St. Louis County through St. Louis City into St. Clair County. And those riders, individuals in need, or just riders in general, know how to cross that river and cross that state. And it's a great collaboration. I think the thing that jumps out to me, the best way to learn about the program is to ride the train and take a tour. And that's kind of one of my
Yeah.
fun jobs, is to give tours.
Yes.
That's the way they really get to see how it works, because they see the
Great.
staff on the ground connecting. But in lieu of that, over the last 4 years, our job is to engage riders and get them connected to some level of care. And so in year one, right in the midst of the pandemic, we connected about 15% of the riders that we came into contact with to some level of care. 15% doesn't sound like a lot. As we've grown that program and we're out on the lines 40 hours a week and doing different shifts, year five, our engagement rate is 49%. About half the
Mm.
riders in some capacity we engage. And I attribute that to, it's all about relationship. And those individuals, our staff, used to have to go around and not chase down, but go around and engage and be proactively engaging. You watch the staff work now on the transit line. The individuals, the riders know who we are, and they come up to them and say, "Hey, I could use a connection to detox, or I could use some Narcan, or I've got a friend that needs some help." We're there as a resource, but that engagement rate's pretty
Right.
profound to me in terms of ROI for the service.
It's an amazing program, and while People may not all have the luxury of riding that train. You guys did produce a very effective video on the program. I recommend anybody interested to go check that out. And it also is a great example of the creativity that goes into pulling all the elements that are required to come together in order to make these things successful, to bring in all the stakeholders. That's obviously sometimes I know herding cats, getting the funding, particularly as you said, if you have a program such as this that spills over into two states, right? Medicaid funding becomes a little bit more complex.
Correct.
And
Mhm.
so it's a great example of Lighthouse and Chestnuts. And I've seen this in other programs that you pull together. It just requires an amazing level of creativity. Speaking of, I want to also ask you about Chestnut, Jefferson County, and school-based programs. It's also a great example of this.
Sure. Jefferson County, which is part of the St. Louis metro area, and if you're not familiar, there's parts of Jefferson County that are almost urban to very, very rural. It's the sixth largest county geographically in the state of Missouri, and that brings a host of challenges itself. But in 2019, a funder of ours, the Jefferson Foundation, came to us and said, "Hey, Chestnut, we have some issues in terms of access and people being on long waiting lists and taking 6 months or a year to get in to see a psychiatrist or get their meds prescribed. And can you help us out?" And this was the opportunity I saw to really show our stuff, show our wow factor in Missouri. And in 2019, we were funded for a 3-year grant. Our clinical staff immediately began providing quality clinical services, outpatient substance use for adults, criminally justice involved, and then school-based mental health services. My job as business development was to kind of fast forward through those 3 years and make sure at the end of that 3-year grant period, we had diversified our funding enough that we just didn't, like some grants, disappear, but we were able to continue providing services and grow our programming. So the 3 years ended in 2022. Here we are in 2025, and we continue to grow our programs. We have partnerships, collaborations with now 10 school districts in not only in Jefferson County, but in other counties in the St. Louis metro area. We have a robust adult outpatient mental health and substance use program that serves Jefferson County. And we just hired in the last couple of months a full-time boots on the ground psychiatric advanced practice nurse that is providing services face-to-face in Jefferson County, as well as telehealth that 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 goes to that win for the funder of limiting access issues in that area and getting people in to see providers or counselors in a more timely fashion. And so really those things have really taken off. I would say January 1 of 2020, we hired our first clinician, and here we are 5 years later, about 35 full-time staff in Missouri, compared to about 800 Chestnut as an agency. But we've grown pretty exponentially over the last 4 years with those partnerships and collaborations.
Another thing, Chess has been very successful in providing access to services in urban and rural areas where access is limited. What are the common challenges in those settings, and what makes a rural region different from an urban as far as facilitating this access?
Yeah, I see similarities both in the urban and rural. They just look a little different. I think the number one issue at times is transportation. You're in a rural area and it's 30 miles to the Chestnut office or to a clinician's office, and you don't have reliable transportation. And that's in the rural area. In urban areas as well, if you don't have access to public transit and you're in a not in a situation where you have your own transportation. It can be even though it's down the street or a couple miles away, it might as well be 100 miles away. So transportation is a big barrier. And if you worked in the behavioral health field as long as I have, that seems to be the number one issue that there's restrictions on grant restrictions on funding transportation in a grant. We can pay for everything, but we can't pay for
Hmm.
transportation. And I find it an opportunity as we foster this 4-year relationship now with a transportation entity, a large transportation entity by state development to kind of figure ways to build that better mousetrap and find ways to negate that transportation issue. But transportation, whether urban or rural, is the biggest barrier. And I think partnerships working with transit districts and transit services is helping us
Hmm.
figure out ways to achieve that better. I also look at family support, mental health, and substance use specifically, a lot of stigma. So sometimes individuals are ostracized, so they don't have as strong a family support as if they had other areas of need.
But of course, it has nothing to do with a regional influence, sort of a shared challenge, regardless of
Right.
where you work
Yeah.
or live.
And one of the things that I'm really proud of with Chestnut is we have kind of a mantra that we know those most in need, we're going to have to get to them versus them get to us. So whether it's in school-based and having embedded staff that are in the schools, working with the schools, when we had the global pandemic, we first started in Jefferson County. We were in the schools about a week before in March of 2020, all the schools shut down. So we had clinicians on sitting in the front yard meeting with uh, students in their homes and families in their homes. And that's still the way we operate. Our Metro Transit program, our peer specialists are meeting with those individuals on the train trying to handhold them
Mhm.
to the services. We know that their lives a lot of times are in such crisis that they can't schedule something
Yeah.
a month out and be expected to show up at an office 5 miles away. We've got to get to them, and I think we do a pretty good job of that.
Yeah. I would think also a difference is that urban environments travel could to some extent be mitigated by having internet access, which is more readily available than in rural areas.
Right, right. Yeah, and I would say that's a big issue in Jefferson County specifically. We do a little work in a couple other counties that are a little more urban, but there's spots in Jefferson County that there's not a good internet access. So if they have transportation issues and they can't do something via telehealth, then we've got to figure a way to get to them, and that can be challenging and can be a strain on a capacity with the staff that we have, but that's something that we always have to be cognizant of.
Yeah. As you know, as many of our listeners I'm sure know, Missouri Senator Josh Hawley has been a vocal critic of proposed cuts to Medicaid, bringing attention to the targeted high impact programs that it funds across the state and the people it will negatively affect if those funds are in fact cut. What do you see as the impact the proposed cuts will have, particularly on the work Chestnut does across the state?
Yeah, it's something that I'm pretty passionate about with my background in advocacy and being aware, being an educated a voter and aware of the issues. One thing I'm very proud of, Chestnut has always held part of their mission is to serve the uninsured and underinsured, and a lot of times those are individuals with Medicaid services versus private commercial pay clients. While we do both, we do a great job of getting to those that have limited resources. And from a Missouri perspective, if the cuts at hand that just passed the House of Representatives, if those make it through the Senate without changes, that's about a $2 billion impact on the state of Missouri. The state of Missouri spends about 26% of its expenditures for Medicaid and SNAP and food assistance programs. And, there's been a lot of work over just the last few years. In Illinois, Medicaid expansion's been around for many years, but just in 2020, by the vote of the people, at a percentage of 60%, the Missouri passed Medicaid expansion, which opens up Medicaid benefits to 100 those individuals that are at the 138% poverty line. So there's just so much, and we're just getting able to serve so many more, that these impacts would have a devastating effect. And I want to just put in quick perspective. And there's a congressional district in southeast Missouri, which is right on the cusp. In fact, part of it is in Jefferson County. It's the 8th congressional district, and about 150,000 individuals in that congressional district, almost 20%, receive some level of Medicaid assistance. And the U.S. congressman that serves that district is the chair of the Ways and Means, so he has a lot of influence. And where I'm at, we've had great conversations with some of these elected and their staffers, and we've expressed our concerns. But I think what I always try to rally is the individuals that are living here need to be aware of what's coming around the corner and be able to speak up and as a voter and a constituent in Missouri, express how these impacts will affect Missourians. And I think Senator Hawley has the foresight of seeing that, and he's taken a strong stance, which we're very appreciative of, as this now all goes before the Senate and they start debating.
Yeah, no, well said. In fact, Senator Hawley's staff, if you're listening to this, we welcome the senator to come on the show and discuss this very important issue. Jim, I really do appreciate you taking the time out of your day to speak with me today.
Absolutely. Great to be here. It's an honor.
Thank you so much, Jim. Appreciate it. Today, I spoke with Jim Wallis, Director of Business Development with Chestnut Health Systems. We talked about his yeoman work on behalf of Chestnut across the great state of Missouri. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.